Hey everybody, welcome to today's video. Today I want to talk about, please ignore all the boxes in the background. We're actually moving out of our house, so we've been loading up boxes and getting prepared to do that. So watching the biomechanics, making sure that we lift properly so that none of us are injured, because you know, it'd be pretty bad if I walked in all hobbled and tried to help you guys with your injuries, wouldn't it? Now, I've been talking quite a bit. I know I made a lighthearted video yesterday about the aluminum foil and the fact that you punch those edges in and the foil won't come out. And, you know, it's one of those things that have been there forever, and I thought it was kind of cool, so I thought I'd put a video out about that. But I've been talking quite a bit about decompression. And I was thinking that it might be a good idea to talk a little bit about how decompression works versus inversion tables. Now, what an inversion table is it's those tables that you see. They're becoming very, very popular. And basically what you do is you get up in the table and you hook your ankles in, and then you lean backwards and the table flips you upside down. And the theory behind it is that you're reversing gravity, so the pull of the body gives you the stretch and the decompressive effect. Now, these things are awesome. I really, really, really do like these things, but there are times when they're not such a good idea. I have had a lot of patients that you know, will use an inversion table that will do very well. They'll you know, I won't see them for a while. It'll be because they've been doing the table and their pain has become, you know, greatly reduced. But the problem with an inversion table is this: you have my handy dandy artistic work here. You have this is your spine, and each spine segment is consistent of a bone, a disc, and a bone. Now, in the disc, this is where a lot of the problem comes, and then there's a hole right in here that the nerve comes out of. So if that disc is bulging or is degenerated and that hole is closing up or something like that, that's where that pressure comes on the nerve, and that's where we need all these treatments, decompression treatments or inversion table. Now, what the inversion table does is when you turn upside down, then it's pulling gravity in the opposite direction. So theoretically, it's stretching these joints, just like a decompression table does. But here's the critical problem with that. Each one of these segments is held into place by ligaments, but more importantly and more significantly in this conversation, they're held together by muscle. And what happens is when you stress this joint, those muscles are going to tighten to try to protect that joint, because this joint's injured. If there's a disc issue or degeneration or something like that, that joint is injured, and your body is going to kick those muscles in to try to support that joint as much as possible. So those muscles are actually going to splint against that joint. So then what you have going on is, if you're on that inversion table, or even if you're on a traction machine, the difference between traction and decompression, this is a good time to talk about that as well. Even if you're on a traction machine, anything that you're on that gives a consistent pull against that joint, well, if those muscles are splinting, then you're not actually getting in there and affecting that joint. What you're doing is you're fighting with those muscles. It's just solid tug-of-war against those muscles. And unless those muscles will relax, you're not going to get in there and get the effect that you're looking for in that joint, which is to take these joints and spread them apart and take the pressure off the nerves. You're not going to get that if that muscle is constantly fighting. So the problem with an inversion table that could cause you trouble is if you go upside down or at a 30-degree angle or whatever the machine says, and the muscles fight against the inversion aspect of what you're doing, what they can actually do is end up squeezing that disc harder because of the muscles fighting it, squeezing that disc harder, squeezing that joint harder, and causing inflammation in the joint and making the situation worse. So you've got to be really careful with inversion tables, especially if you have a chronic disc issue. You also have to be careful with traction, because traction does the same thing. Now, what traction does is it's a machine. You lay flat on your back or in whatever position, and as the traction pulls to get that stretch in there, it pulls and it's pulling against the muscles, so you have the same response. Now, what decompression does that is totally different and is totally revolutionary is inside of the decompression machine, there is a computer program and a sensor that senses when those muscles tighten up. So if you're ever watching the monitor on a decompression machine, you'll see that your weight will start going up, the pull will start going up, but then it might dip down a little bit, and then it starts going up again, and it might dip down a little bit. Well, those dips are the machine actually sensing when those muscles kick in and kind of give excess resistance. So what the machine does is the machine responds by letting up on the pull. lowering that pull. So that allows those muscles to relax, and then it pulls again and the muscles relax. And it kind of works through it to where eventually it's able to get through the muscle guarding that goes on around the joint and allows these joints to relax. Now, you may wonder what this feels like. Well, if you've ever been adjusted and you keep saying to yourself, I can't relax for an adjustment, you'll notice that especially as a chiropractor, I notice this all the time. Before I thrust on a patient or before I put the impulse in to cause the adjustment, a lot of times, even subconsciously on the patient, the muscles will tighten up to protect that joint or guard that joint. And if I try to thrust through that and fight through those muscles, I'm probably going to, cause a flare-up, and it may not even move the joint. So then you have problems. Same thing with decompression. If those muscles are tight and you try to put the therapy through those muscles, it's going to cause problems. So that's why decompression, that's how it's different from traction, which traction is what you commonly would find like in a physical therapy office or some of the older stuff. On some of the cheaper machines, the decompression machines that we have right now, these are, almost $60,000 machines. There are some machines out there that, the decompression machines that get a lot higher end than that, but they have a lot of bells and whistles that, we just opted not to have in ours. But the cheaper traction machines, they don't have that ability to sense that muscle tension and to lighten up. So that's the key factor, and the inversion table obviously doesn't have that as well. So with that being said, before you go out and buy yourself an inversion table, give me a call. Let's talk about it. Let's see if it's something that your case might warrant. For example, I had a patient today that was asking me if he should do decompression. Well, he didn't need decompression. He was somebody that the inversion table might be a good process for him, and it's a little bit of money up front, $300-400 for the inversion table, but it's a lot cheaper than what the decompression machine could cost you. So and that's what would work for him. So I'll tell you which way I think you should go with it. I just want you to be careful with it and not cause yourself more damage. Okay, I hope this helps. I hope this information is good. And again, if you know anybody who's facing, spinal injections or back surgery, before they do it, just have them give me a call. Let me sit down with them and see if it's something that I might be able to help them with, because, failed back syndrome, after you've had a surgery and then the pain returns, once you've had that surgery or once you put those chemicals into your spine, your body has changed, and it's hard to get in there, and it makes it more difficult to fix. And a lot of times it makes it unfixable. So if you know anybody, please have them give me a call. I'll sit down with them, talk to them, and we'll see if we can help them. All right. As always, my hope for you is that you take control of your health before your health takes control of you, and I will see you next time. Have a great day. Bye-bye.